The conceptual practice model, KAWA, was created by Michael Iwama in the year 2000. This model was created specifically for collectivist cultures but can be applied to anyone.
Meet Jerry. Jerry's a 77-year-old man who immigrated to the U.S. with his family 50 years ago. He lost his wife 5 years ago and lives with his son and daughter-in-law and 8 grandchildren. He's a successful small business owner. His family describes him as a proud, independent, and driven man.
The key idea of KAWA conceptual practice model is to view the client's life as a whole. There are no formal assessment tools used by occupational therapists, but the informal assessment tool is the creation of the client's own metaphorical river. The therapist explains the 5 key elements of the metaphor. The client can either construct their metaphorical river or just discuss the main components of their river. Based on the circumstances, the occupational therapist can choose an intervention to focus on, reducing the size and shape of the obstacles, or focus on the spaces in their river to determine strategic ways to maximize their flow. The metaphor consists of 5 key elements: river flow, river banks, rocks, driftwood, and spaces. The river flow represents a person's life flow, energy, and priorities. The river banks represent the person's social and physical environment, supporting and shaping the river's flow. Rocks represent circumstances that can impede the flow and change the direction of their river. Driftwood represents personal attributes that could hinder or help the person's flow. Spaces represent the strengths and unobstructed portions of the river where the water flows freely.
Jerry recently suffered a left CVA in his posterior cerebral artery. He suffers from right hemiparesis and alexia without agraphia. He has been released from the hospital and is now receiving occupational therapy services in an outpatient clinic. Jerry's occupational therapist, Thor, is using the KAWA conceptual practice model to help Jerry find ways to increase his life flow and participate in roles within the family. Reviewing Jerry's river, Thor and Jerry look at recent life events that have impacted his flow. Jerry's river began deep with strong social supports, a strong flow, and very little rocks. When Jerry's wife died, it was a big rock and barrier to his flow. With the support of his family, he was able to push past this barrier. A few years down the river, a very large rock appeared in the form of a stroke, significantly altering his flow. With the help of his occupational therapist, Thor, and Bonnie, he is adapting and finding ways to utilize the spaces in his river to succeed. Jerry has driftwood in his river. Some driftwood that has impeded his flow is his pride and difficulty accepting help from others. The alexia his stroke has caused has made it impossible for him to run his business alone, making him feel like he is not adequately supporting his family. Jerry's motivation and hard-working attitude serve as pieces of driftwood that help break down barriers along the way. Using KAWA, Jerry and his OT were able to find and form new spaces in his river to make his river flow deep and smooth once more.
One strength of the model is that it was specifically created with collectivist cultures in mind, while most other conceptual practice models were created from a Western perspective. Most other conceptual practice models are client-centered, which contradicts the values of a society that focuses on the family and community as a whole rather than the individual. One critique of the model is that the lengthy and personal nature of the river metaphor cannot be properly utilized in all settings or with all clients. Short-term settings such as acute care do not allow the time necessary to fully understand and discuss a river model with a client. Although it is encompassing of more than just Western cultures, it does not encompass all cultures. Consent forms were signed by all participants. No mannequins were harmed in the making of this film.